who is going to present the embolized device removal by surgery. Dr. Abir Tazim Chowdhury.
Very warm greeting to all the learned audience. It's me, Dr. M.D. Abir Tazim Chowdhury, representing Abir Hospital, Dhaka. Let's start with poetry. Spring has passed, summer has gone, winter is here, and the song that I mean to sing remain unsung. For I have spent my days for stringing and unstringing my instrument. These words by Kobiguri Rabindranath Tagore capture the sentiment of regrets for wasted time and opportunity missed. In medical care, time is a precious gift that cannot be wasted. Every note must be played precisely, and there is no time to pause and tune the instrument. Prompt and effective management during a medical emergency is essential to prevent further harm. Today, I will discuss a topic of medical emergency and a case we dealt with recently at our hospital, that is embolized cardiac devices and its surgical retrieval. A cardiac device embolization refers to any cardiac implant that has dislodged from its intended position and migrated to another location within the body, potentially causing harm to the patient. The devices that can be embolized are pacemaker or cardiac defibrillator leads. We all know that these are the essential component of cardiac implantable electronic device. Next is the transcatheter heart valve. Their implantation is getting popularity in the recent years. Transcatheter left atrial occluder, appendage occluder, is an increasingly adopted therapy for the stroke prevention in a patient with atrial fibrillation. Septal occluder is mostly used cardiac device in our country, all over the world actually, and are essentially replace surgical repair in majority of the cases. However, the most reported cases of device embolization. What is the incidence of device embolization? It is difficult to assess. It is because of underreporting bias. Majority of reported survey conducted among the medically approved proctors. Reported rate may be lower in a more expanded group of operators. Notably, the reported prevalence of device embolized cardiac devices may vary depending on the patient population, the type of device, and the study design. Factor contributing to the device embolization can be listed in the following ways. Number one is the complexity of the anatomy is the most important one, sometimes make it challenging to deploy the device. Number two is the device itself. For example, too large or a small device may be more likely to become migrated. Number three is the patient himself or herself with the congenital heart disease or pulmonary hypertension may have abnormal anatomy or a higher pulmonary pressure, making securing the device is more difficult. Another one is the improper placement of or fixation of the devices or trauma during the procedure. And number five, last but most essential, if it is missed, it may cause the device embolization, that is the immediate post-implantation review, adequate follow-up care with the device checks and monitoring. The clinical presentation differ according to the device embolization.